We know that healthcare innovation is challenging for a variety of reasons. We know from the announcements this week and being here today that Plug and Play and TMC are doing work together to fill some of those holes. We know that entrepreneurs are seeking unfair advantages. We know that you're trying to grow your business, solve a problem, and find paths to market, Albert. And we know that the member institutions here within TMC are looking at ways of how they're going to drive external as well as internal to drive their business and support. So why don't we first start? I always like starting with the entrepreneur. So why don't we start with Albert? Specifically, as you think about launching Allotrope, from Methodist, and you got Murat sitting right here. What's something either within your journey looking back, or as you look forward, that if you're speaking directly to Murat, that they should consider within Methodist, not necessarily within your negotiation or negotiations with them, but just really to more empathize with the perspective of the entrepreneur, where if they're looking for a benefit, they're looking to adopt technology, they see it as a business advantage or increased standard of care. What's something very specific that you would say to Murat and to Methodist that they should prioritize or really consider?
Yeah.
I'll take notes.
Okay. So there's two things that really come to mind, and definitely I think they are not just for my company, but other startups that are trying to come into the ecosystem that come to mind. The first is really streamlining and optimizing the technology transfer process, right? It shouldn't be like a 6-month, 8-month negotiation. Not only can a startup not be able to manage that financially and also time-wise trying to move fast, but it doesn't benefit the hospital either, right? It means that the deal flows a little bit slower, things can die in that process. So being able to standardize that with very simple documents would be amazing. It would also mean that the possibility for startups to license technology out, or entrepreneurs within an institution wanting to spin something out, it makes it a little bit more tangible and possible. The other thing that I'm, as an entrepreneur, definitely not alone in is being sure that the solution that we have for our technology aligns with what the hospital is looking for. So for us and for a lot of the companies here, we often have to do a shotgun approach to talk to as many doctors as we possibly can to try to find those ones that are going to be interested in what we're doing. So for an organization such as Methodist, having that landing spot, having a point, or like what you guys have, like an innovation panel to say, here's our solution, does this align with what you guys are doing? And can you point us to those physicians or those departments that are going to raise their hand and say, we really want this, and then both sides benefit with new technology and us being able to hit the ground running.
So Albert, you're really talking about having these innovation champions
Right.
who are really clear, and here's what we're trying to do, and here's how we work, and here's how we work externally as well as internally.
Right.
Is that right?
Yeah.
So Murat, I'll ask you to first respond. What is Methodist going to do in response to Albert's request? But no, seriously, I'd love to get your perspectives, just based on what Albert shared.
I think so. Just to answer the first part of the question, or to answer your first demand of simplifying the documents, I think that's where Plug and Play, TMCX, those type of institutions could help us, because with their help, if there's a streamlining process, because everybody who works within a hospital knows procurement takes a lot of time, legal takes a lot of time.
Right.
But maybe we need to do that work with the TMCXs of the world beforehand, so when you are in this incubator, we know that anything that comes up from that meets those standards, checks those boxes, so it'll be easy for us to accept that. I think we just need to, we're not there yet, but I think that would be something that we need to really collaborate, that we need to work on, that simplifying that process. In terms of finding the champions, I think, I'll just say it, I don't think that we're that good at knowing, so we have certain goals. We have certain clinical goals, certain business goals. We're very good at knowing those, but when you offer something, it's very difficult for us to find those champions. There are people that we know of that are constantly in touch with us, but we just need to know our people more, know our champions more, and just empower those champions. So that's something that we internally really need to work on.
Even just knowing the hospitals and your committee's identified needs externally, in a public way, would be super useful for a lot of the startups, right? Then it's just should I spend my time working with you, or is it going to be a non-starter?
That becomes challenging sometimes, though, because some of those needs are not, we don't feel comfortable always sharing those needs. So, I mean, then again, going back to the collaboration, so maybe we need to have that conversation strategically with TMCX so they would know. So we know that our trade secrets
Sure.
or our lacks or needs are kind of hard because we're not going to put it on our website. These are the areas that we suck.
Yeah.
Yeah. But a perfect
in.
intermediary for a
Yeah.
plug and play or a TMCX
Yeah.
to come in.
One thing to add here regarding simplifying documents, not an example in healthcare, but with Ford, when we were working with them, they had a 40-page MSA when they were engaging with us and then with startups. And what we did with them was to consolidate it down to 2 pages, where obviously a startup does not have a lawyer that they can pay, and the fees can be quite costly. So working with some of our corporate partners to do these best practices seminars around how to engage with startups, just even from a legal perspective, has really helped in the automotive industry, as well as now that transferring into healthcare as well. And to the second point, just around the challenges and pain points. One of the things that we're doing with some of our healthcare partners is getting a more specific internal brief that we can then share with the startups. So this is something that we already have an NDA signed with the startups and with the corporate partners, so we can be kind of the middleman to share that. And typically, in some cases, they can be very specific as far as like the checklist of what the partner wants. And that's something that we share in the briefings prior to the one-on-one introduction so that the startup can either customize their pitch or their proposal to that specific hospital or pharmaceutical company.
Yeah, and I think that's a big theme, right, of looking at like whether it's procurement or legal, payment, finance, and like how checks are cut, and even thinking about allocating budget for pilots and how to think through those pieces, as well as getting into the business units itself. A lot of these structural pieces become, Neda, maybe you could talk a little bit more about this. You're doing this with other companies. You mentioned Ford, but having like that internal capacity and playbook in order to drive a lot of these efforts. Where do you see like larger enterprises like get that wrong, where they want to come here, they want to hear all the pitches, but they're not organized internally to do so? Does that happen a lot?
Yeah, definitely. I think one example, again, non-healthcare, but Lowe's has kind of a sandbox that they have for testing and piloting startups that's right around the corner from our office. So they already have specifically a budget allocated to startups where they can actually engage and pilot those technologies within a store that's a sandbox store to test them out. But I think one of our big asks from our partners, just from a internal perspective, is really to have a champion, whether it's an innovation manager or someone that really advocates these startups internally. So someone that will find the clinician and will find the business unit, will get the legal team. And the more people actually that come through an accelerator like this or to Plug and Play, the more they kind of realize also engaging with a startup is not, engaging with a corporation. So understanding that, their office space may be just those 2 desks and just understanding the structure and the setup really helps internally be able to push these companies through. So one of the big asks we do have is to have at least 4 to 6 times a year to come to visit Plug and Play, whether it's a Plug and Play in Houston, a Plug and Play in Cleveland, or Silicon Valley, but to just have that cultural mindset shift take place around what it's like to be a startup or to be in an accelerator. So the time commitment is a big component of it. And another component is business unit sponsors. So making sure that startups that are engaging with corporates, the deals don't die in the middle, so that there's clear metrics around working with startups, being innovative, and that there's clear kind of KPIs that are set around that.
Yeah, and before we get Tom in here, I want to come back to Murat first. And on that and thinking about metrics, and we're talking about like the playbook and capacity, and you talked about simplifying process, and even like looking at how you run the business over at Methodist. What does success look like today as you think about the Center for Innovation at Methodist? what are some of the kind of key metrics that you all are thinking about, and how are you going to measure success, like internally within your business unit, your stakeholders, your board? What are some of those things that you buy?
So two things. So we're looking at two things when it comes to each pilot. So Center for Innovation, one thing that we do is we take these companies or we take these new ideas, we pilot it for a predetermined period of time, and then if it's successful, we actually graduate it. But so success is a very important part for us to kind of figure it out. And we have two things. We're looking at two things. Does it work technically? Does the technology do what it's promised to do? That's the first step. And if it moves past that, what was the business goals that was set for success metrics for that pilot, and did we achieve those? You know, ride sharing was an example that was shared here. What was our so no-show rate? What was it after we implemented this pilot? So for each pilot, we're actually setting business metrics. But first, we need to figure out, does the technology work? Does it work in our ecosystem? Because also the other thing that maybe I need to clarify is, yes, these technologies work. There's a reason that they've been in these incubators. But when you put those things to an already existing ecosystem, it needs to work with our electronic health records, other type of business systems. It needs to meet our security guidelines, etc. Does it work in our ecosystem? So maybe just to clarify that. And as I said, for each pilot, we have a success metric, business success metric. So does it work? Does it make business sense? So we ask these two simple questions, and if it doesn't meet any of them, then it's not a success to us.
Yeah, so Murat, on that, let me just like dig a little bit. So one of the things, especially doing work with a lot of industrial companies here in Houston, where we've seen things go wrong, is they're thinking of longer term at an enterprise level deployment, measuring ROI before we even get into experimentation. So if you think about like what good business sense means, how do you think about it, from the standpoint of pilot and experimentation? Are you looking at it as like, did it answer this question? And as those things wrap up into a broader, we want to run this many experiments, or we're trying to drive this much kind of business value, or we're looking at X or Y or Z.
So this year, we're not thinking in those terms. This year, we're not saying that, okay, we're going to pilot 10 different projects. We actually went from a more strategic perspective, so we set strategic targets for our Center for Innovation. So I talked about two things, consumerism and simplifying our business. So around those two things, we set up strategically, what does it mean to simplify our business? So we're just trying to pilot things that meet those strategic guidelines. So this year, we don't have a pilot number in mind, but every pilot that we're taking on, we're just asking ourselves, does it meet any of those two strategic goals, high-level strategic goals? And we identify tactics behind those strategic goals. So this year, we're looking at it more strategically. Does that answer?
Yeah, it does. So let's go to Tom. He's been sitting over there, probably has a ton of things to say, but on Murat's comments about simplifying the process, simplifying the business, the mission of the TMC is really to bring value to the member institutions, right? And here at TMCX, do so through these interactions more with earlier stage companies. So so Tom, could you share a little bit about how is TMCX helping simplify that process, and what are you seeing from an engagement level from the member institutions? There's 63 member institutions.
Sure.
They're not all equal as far as what they do, their size or scale. So, talk to us a little bit about what you're seeing and how those institutions are engaging.
Yeah, I think that for us, TMC Innovation and X is an important part of innovation. It's, our core strategy, we're a business advisory service, right? We provide sort of access, we provide resources, we give each of the companies that we engage with, our member institutions, our corporate partners, a reason to be here, a team that's supportive, and hopefully for all of them, a chance for them to be more successful being here than they would if they weren't. When you think about simplifying for the member institutions, to me, it's pretty clear. You have to understand what the needs of the member institutions truly are. And, the scale and the quality of the institutions at Texas Medical Center, allow us that if we can solve some of those needs, we're likely solving needs more broadly across healthcare. And so a focus on that is really important to us. And it's really goes back to the mission of why we create, well, Texas Medical Center in general, health, education, and research here in Houston, and TMC Innovation, to think about those three things and how we can engage with the member institutions. I wouldn't say that we've done it incredibly well in the past because, what you wind up finding yourself focused on in many cases are you're looking for great companies. Like if we think about X and how we recruit companies to X, it's like, oh, this is a kick-ass company, right? And from an investment perspective, why we wouldn't have them in here. But if you bring them and you recruit them to Houston and then it turns out that like none of the member institutions really are paying attention to that company, it's a bit of a fail for us, right? It's a great investment, but we're not really focused on solving the needs of the member institutions. And so we're turning that a bit, simplifying it a bit, making sure that as we look at the companies that we want to be in our next cohort of X, or for our next sort of set of fellows at Biodesign, I mean, that's how they're focused. That's what they do, right?
Yeah.
They spend the first time thinking about the member institutions. That's an important kind of tweak of what we've done in the past that we'll be very focused on moving forward.
Yeah, I mean, you just speaking to that point, I know from like working with the fellows here, I think there's some list of about like 400 or 500 different problems
Yep.
they've identified within the member institutions to ultimately find, 2 audacious problems.
Yep.
2 that are like significant of scale and priority to go build a business around that. So I want to, I don't know how we're doing on time. Somebody?
We've got a thumbs up from Emily.
Does that mean just keep
Keep going.
10 more minutes? All right, and I want to make sure we get time for questions. So I want to go back to Netta, just, really like, it's really exciting. I mean, all this, there's been a lot of momentum here in Houston over the last few years that many of us in this room, in the community, have been, trying to, just play our part to drive. So seeing Plug and Play come and seeing an opportunity in Houston is really exciting. A lot of that was spoken about yesterday. What I want to like kind of dig in is understand, is Plug and Play like works, across the world, right? And works within all these different industries. How do you see opportunities for convergence? So I'm sure there's structural pieces like you mentioned before with the Ford motor, and here's some things that, were challenges that may be applicable to a Methodist. But then as we think about like getting into some of the business objectives, as we start getting into like, well, here's ways of really moving the needle, where do you see convergence from where, hey, here's healthcare, but this is the way in working with energy or working within automotive that we think that these are great opportunities either to solve direct problems or to create, new markets or new opportunities. Can you share a little bit about that?
Definitely. So specifically to Houston, initially we would be going into energy and healthcare as far as the topics here as a location. In other locations like Cleveland, for example, we started off in healthcare, but are now trickling in Enterprise 2.0 and HR and recruiting as a topic as well. Within Arkansas, where we just launched an office with Walmart, we're covering supply chain, but eventually we'll also cover other topics as well. So within Silicon Valley, we're covering 14 different topics, and the way that we're bringing in these different topics into new cities is to see what corporate clusters currently exist from a headquarters perspective. So initially going after the ones that have a higher concentration, but then eventually trickling in other topics where there's an interest probably here in HR as well. And we'll do that through an innovation day. So similar to what we did today, it's a half-day event. We invite the different corporations and the startups to participate in that session. And then we'll also put together a roundtable with the different corporates, because a lot of times it's not about meeting startups, but it's also about meeting other corporates that are going through similar challenges. And that's really where a lot of the magic happens as well, around sharing notes on the legal process or the procurement process, or finding champions internally and what are the best practices there. So we also put together forums to facilitate that. And then another thing that we've actually done back in Silicon Valley is doing specific topic events around like aging at home, which was a topic that we did with our retail program and healthcare. And the partner on the retail side was Procter & Gamble that was interested in that subject. And on the healthcare side, we had AARP and Kaiser Permanente and Lyft that were participating in that topic. So we also will do events like that with the local partners to facilitate a forum where startups can come and pitch to Procter & Gamble and Kaiser, and for all of them to have a discussion on how they can collaborate to create products within the home that make aging at home easier and more convenient.
Awesome. All right, so I want to turn it over to you. You know, I think so. We hit on some great points here about simplifying the business. You know, I think as we think about like what Methodist is doing, really sounds like here's the way we're thinking about it now that's going to shape the future. You know, Albert shared some really pointed points on his experience as an entrepreneur. You know, gave two really specific examples. And Neda like shared a lot of, you know, really like one of the big takeaways here is I think opportunities, you know, where to share this information and how to get people convened, you know, if that's the right word, you know, towards exploring these areas, as well as why structurally you need these playbooks, you need, you know, this operational readiness in order to absorb innovation. And then I think what we're hearing too about like, you know, what's going on here at TMC Innovation and how to drive more work, more engagement within the member institutions to enable like how we change the future of healthcare here in Houston and what that means for TMC Innovation. So let's turn it over all to you. We've got a few minutes. Who's got questions?
Yeah, for Murat, you mentioned the different business metrics that you'll use to measure the success or lack thereof for a pilot. But is that sort of like a binary, it fails or it doesn't fail, or do you ever, thank you, or do you ever measure that versus similar pilots? Do you ever compare similar startups or similar concepts to try to find like the optimal one that best works for your whole centralized system?
So I'll clarify the question just because I didn't have the microphone, but I think the question was, are metrics binary, or how do you think about applying the right metrics to the right experiment for the business case?
We work a lot with the company before we initiate the pilot. What is the value that you're bringing? If you say it's going to be this, we really try, let's say, reducing no-show rates. So we just need to start measuring towards that. We always take it case by case, but so in that one, it feels almost binary to us, but what are the ancillary benefits and how much money we actually put into pilot? So I'll give you a very quick example, real example, automation. So we're working on software automation, intelligent automation. One of the use cases we're doing, it's not really bringing that much value yet. It did not take out as much needed manual processes out of the business, but it's actually bringing a lot of compliance benefits. But is that compliance benefit really has a financial return on us? So we're trying to determine that if it's not going to be, if it doesn't return, if there's not a good return on investment in that ancillary benefit, which was not the intended first benefit, then yes, we're going to kill that pilot. But so sort of to your question, yes, it's almost binary, but always we take it case by case. If there's a good ancillary benefit, we'll redetermine our approach. Maybe we did not anticipate it, or we did not do our homework well when we were doing those business cases first. So.
Hi, more on the advisory side. So probably to Plug and Play and TMCX. I'm curious what you all are doing to help organizations that are slower to change prioritize innovation, get the kind of wheels in motion to operationalize innovation in a larger institute.
Yeah, we think about that a lot. You know, we were talking about this when we were standing over there in the bullpen. You know, are there member institutions that more readily engage with innovation? And if we just think about the member institutions at Texas Medical Center, but you could say that more broadly with just partners in general, including corporates. You know, I came from J&J, so it's a big corporation. You know, how does it think about innovation? And it is a little bit interesting to understand the culture of the organization and then really play that back as to whether or not they're going to want to be involved with an accelerator, as an example, or not. And some do and some don't. I think that what I see from a culture perspective is it really starts with the leadership of the institution. If the people at the top, if the C-suite of the institution are really focused on understanding why their organization is maybe not as performing as well as they expect it to be, and are willing to look outside, that's how it starts in my mind. It's really hard to get kind of the people in the middle of the organization, and especially kind of budget managers that are supposed to be in charge of innovation, to move externally because they think that they have what they need to solve internally. There's a personal value stake in that, like we can do it inside our four walls. But if you can get to the top and make a compelling case and have a person that's willing to listen, then you can really start to move it quickly. But it's my experience, without that top level support, it's really hard to get any large institution to engage with incubators, accelerators, all the other innovation type programs that are out there.
We have time for one last question.
Yeah, I just want to continue what Thomas was saying, and also what Murat is saying. As a startup, one of the challenges is getting into big organizations when they look for first mover. Somebody else adopts the technology first, and then we will follow. That is easy. But how do you get a big institution like Methodist or something like that to be the first mover? To be like, okay, this is a cool technology, we think it's great value, we will move first.
Sir, I think we're having a really hard time understanding you. Can you just ask the question and do it really clearly, just for time as well?
The first mover, how do you become the first mover for a startup?
So from a standpoint of a Methodist, how does Methodist choose, evaluate the first mover? Or what should a startup do to be that first mover?
So what does a startup do to get Methodist to be the first mover, the first big adopter of technology?
All right, so I think the question is, how do you gain adoption? If this is an area of pain and there is an opportunity to solve a problem, how do you work with a Methodist so if it lines up to one of these like innovation focus areas, how do you really drive adoption within the enterprise?
So if you can show us whatever you're presenting, whatever you're pitching is going to either bring more patients, reduce cost, improve safety. If it does one of these three very well, I think it will be easier for us to adopt it. But if we are struggling to find that results, so we're not always going to be the first movers. So one of the strategic conversations that we had internally, sometimes it doesn't make sense to be the first mover in a technology. And we're not just looking in healthcare, by the way, maybe outside healthcare. So sometimes healthcare is very late to adopt technologies, but did it show benefits outside healthcare in other industries? So we're just trying to see, does your company can really do one of those three things very well? If we see promise in that, then yes, we're okay to be the first mover.
I'll add to it. I think when you find a champion, this is a point that was brought up, finding that champion, because you may get the pilot, but driving an enterprise deployment, whether it's in healthcare, whether it's an industrial setting, whether it's in a financial services company, it really comes into how do you drive that process? How do you have that champion? And realize if you're trying to sell at a broader enterprise level, it's not a light switch. It's not like a simple SaaS solution where it's like, okay, we could go from red to green and it's done. There's implementation, there's training. Sometimes there's different security aspects. So I would encourage entrepreneurs to really think about and understand the markets that you're going after. And if you're thinking about first mover, think about like why you've chosen that beachhead to go after and if that makes sense for you as an entrepreneur, and understand what your financial capacity is, i.e. your balance sheet, if you're going to make decisions about what types of customers you're pursuing. With that, we're with time. I don't know what the next piece is, but please join me in thanking our panelists for their insights today.
Look forward to continuing the
you.
conversation.